I was injured about 5 years ago at school. We were having I teach 8th grade, and we were having an evacuation, and there was ice, and I slipped on the ice. So I went through emergency, had to go through orthopedics, and was diagnosed at that time with sacroiliac and hip injury. And I went through all kinds of things with that for the last 5 years, and the bottom line is they misdiagnosed it.
In the year 2000, in March, I was injured on the job where I fell, and it was this somersault in the air, landed on my back, and progressively got worse, and it took 2 years for them to decide to do surgery. And after that, I went into surgery. They messed up and cut some things they shouldn't have, and started having seizures right away, right out of the operating room. And they had me on like 7 different types of pain medications. My legs were starting to get to the point where I couldn't walk anymore. I was in a wheelchair, pain constantly. Just really nightmarish type thing going on.
In March of this year, I had a car collision, and I had a severe neck injury, whiplash, and I called Dr. Kurtz, and he put me in a treatment. I could not even move my neck at all.
Well, the typical patient that comes into Columbia Basin Spinal Rehabilitation Institute is primarily someone who's tired of being in pain. Most of them have done the traditional medical approach. They've had medications, the recommendation for surgery, even physical therapy to a point. And so they're willing to try something else. And we try to utilize the latest non-invasive spinal care to help them get over their pain. We go through a thorough history with them to find out what they've been through, and then we offer a treatment plan.
My treatment goals are pretty simple. First of all, I want to decrease the pain. I'd like to increase the range of motion. That way the patient can be as pain-free as possible and live an active and healthy life like they were before they got in any accident or injury.
Well, non-surgical spinal decompression is an alternative to surgery. The goal is to get the disc or the joints between the discs to alleviate the pain. As gravity compresses our spines down, the disc herniation, if that's what the problem is, will ooze out and pinch or irritate the nerves. The goal of non-surgical decompression is to take that area and to open it up, and so that it takes the pressure and the irritation away from that. In surgery, they would cut open the area and cut out what's ever causing the problem, and possibly use metal rods or different types of bone implants to decompress that area. We try to do that using a more natural means, using specialized table and equipment. We treat specific cases such as disc herniation, disc bulge, disc degeneration, spinal stenosis if it's not too severe, and as well as chronic low back pain that hasn't responded to any other type of therapy. Spinal decompression therapy is a painless procedure. You have total control when you're on the table. We give you a control button that if you do notice any discomfort at any time, you can push it and it will automatically stop. The goal is not to induce more pain. The goal is to remove the pain. And so it's a very comfortable procedure. Most people even fall asleep while they're doing the procedure.
After the injury, they scheduled me actually to replace my hip, and fortunately that didn't go through since it was an incorrect thing. They gave me cortisone in my hip, they gave me cortisone in my side of my leg, they gave me cortisone in my back. I took water therapy, I took physical therapy. I asked Dr. Kurtz to look at my x-rays and tell me what he thought he could do. The only relief I really got was when I'd have my back aligned. And finally, Dr. Kurtz was able to tell me about the spinal aid. And with that, then I was able to actually get some healing.
After the surgery, they said you just have to live with it, can't do much for you, sorry, just try to deal with it. And it was something that I couldn't deal with. I said, no, I got to find something else. This program that they have here decompression. I started doing this and I started seeing results. You know, a couple weeks later, I started noticing that I wasn't in pain as much. I could walk without having to, use canes or sit down every 5 minutes because I wouldn't be able to stand, sit, or walk for more than 5-10 minutes at a time. The seizures started subsiding, and pretty soon, just progressively over time doing the treatment, I started being able to get better. I haven't been on a wheelchair since, so it's really been, to me, a godsend.
We offer several different types of services here at Kennewick Basin Spinal Rehabilitation Institute. Chiropractic care is the primary service that we offer. I graduated chiropractic college in 1990 from Life Chiropractic College West in California. Since then, I've realized that you need several different types of equipment to help the individual. Come from a long line of mechanics in my family, and my dad always told me that if you want to fix more things, you need more tools. So I learned early on that you need more equipment to help these people get better. So we utilize the latest in non-invasive therapies and techniques to help these people get over their pain. From manual adjusting techniques to the new instruments that are computerized, and they can help analyze the spine even at a greater level than a human can. And when somebody comes in here that has neck complaints, then that can usually be from a neck injury, chronic pain, from a whiplash accident, or an old injury where they fell and hurt themselves. We like to analyze them with our multi-cervical unit. The multi-cervical unit was designed to assess and to treat chronic neck pain. It has excellent results. When you get into the unit and the computer analyzes your range of motion as well as your strength of your neck as well as your pain as how it relates to strength and range of motion. So we can use the sophisticated software to give us a treatment program that will look at these weaknesses of the neck and allow us to strengthen up that area. We do know that research states that over 70% of chronic neck pain is muscular related. And so we need to address that component of the pain. If the neck is weak, or if it does have problems in range of motion in certain areas, then we can address that using the multi-cervical unit. After we've done the full testing with that equipment, we exercise and strengthen up the neck. We can specifically strengthen up any individual group of muscles around the neck. It's the only piece of equipment like that in the world today. It can analyze completely 360 degrees around the neck, all of the muscles of the neck and how they relate to your range of motion, your strength, and your pain. The beauty of this piece of equipment is that it is painless. You work at your own rate, and we have a therapist that is right there with you the entire time to encourage you to do better. And so it works out excellent as to overcome these problems of chronic neck pain.
Cervical Traction unit is a great piece of machinery, gets a lot of people better. Basically how it works is people that have a lot of chronic neck conditions, a lot of irritation of the spinal nerves, sometimes cause a lot of headaches and muscle spasms. We put them on there, and it very gently takes the pressure off the spinal nerves.
We also have spinal decompressive traction for the neck. We utilize this along with the multi-cervical unit and have a very successful treatment program for chronic as well as acute neck pain.
My job is very fine soldering under a microscope. After that injury, I couldn't do it for solid 2 weeks, so I was getting treatment every day with Dr. Kurtz. He used the MCU unit and the compression machine also. But after the treatments that I had with those machines, my neck have been very strong, and I don't get those pains in my neck anymore because I do the exercise he suggests to do every morning and then the evening after work. And my neck is strong.
We also utilize our laser, which is a low-level laser therapy, but it's a class 4 3-watt scanning laser from a company in Italy. And we're the only ones in the West Coast that have this piece of equipment. We utilize this for pain control as well as warming the tissues deep within the tissues. It's very comfortable. There's no pain involved. The coherent light from the laser penetrates through the skin and gets deep into the individual cells, and it allows the uptake of oxygen better by allowing the mitochondria, which is a portion of the cell, to uptake oxygen a little bit better. So it helps not only to decrease pain, but it also helps with healing and to get it better. And besides that, it's a really cool piece of equipment, and people are really excited when they see it. We also use other rehabilitation equipment to help people get over their pain. We have an ambulatory traction unit where we hang somebody from a harness from the ceiling, and we can use the correct poundage to lift up to 50% of the body weight off as they walk on a treadmill. It's a unique device that is relatively new in the treatment of spinal conditions, primarily of the low back, and it allows us to rehabilitate and to work the spinal low back muscles while they're under care. We utilize this in conjunction with spinal decompression as well as standard chiropractic care. Okay, the types of conditions that we treat are neck pain, both acute and chronic, lower back pain, including disc herniation, sciatica, stenosis, degeneration, as well as chronic and acute pain from work injury or any other type of injury. We also treat extremity conditions such as carpal tunnel syndrome if it's not too severe, shoulder problems, knee problems, ankle problems, as well as hip problems as they relate to the spine. We basically do all things spinal related, such as our name implies, Kennewick Basin Spinal Rehabilitation Institute. If you are curious if we can help you, if you are tired of the pain, if you are just sick and tired of taking the medications, not getting the answers that you're looking for, come see us. We will try to answer your questions. We have all the latest equipment in non-invasive treatment that we can handle the majority of the conditions that we just talked about. We like to spoil our patients. We like to treat you as a king or a queen as you come in here. We want to make your experience with us one of the best you've ever had, and so that you can also work on the mental aspect of pain to help you be a happy person as you leave, both with your treatment and your experience with us. So come see us, and we'll try to solve your problems to the best of our ability. That's my promise to you.
I'm sewing, and I'm back to painting. I am an acrylic painter, and I'm back actually carrying my easel and my paints around, and I couldn't even carry my purse for the longest time. So I'm thoroughly enjoying it.
One thing about Dr. Kurtz is that he's positive. He looks at things differently than the average person does. The doctors tell you one thing. It's not that he's a miracle worker, but he's found something that does work, that does help. You don't have to go and have surgery and have something cut on you. If I knew then what I know now, I would have jumped on this right away, because when they go in for surgery, you don't know what to expect. You don't know what's going to happen. I'm getting back to playing the bass again. I'm playing the drums again, playing the guitar again. I went out on a hike, took my boy fishing for the first time in almost 8 years. So it meant a lot to me, because you're getting back to what life really means, and that's enjoying it, not just being a spectator and watching life go by.